Hi, my name is Claudia Horan and I'm 15 years old in Year 10 at Orange Anglican Grammar School. Today I'll be answering the question, how can we improve women's healthcare globally? When put into a situation where medical attention is vitally important, all patients should be required to receive the best possible treatment. However, societies continue to fail women in terms of health, particularly in low resource settings. Discriminations based on gender has a negative impact on women's health. Women's access to healthcare services is frequently hampered by structural determinants of women's health as well as legal and policy constraints. Governments have taken steps in recent decades to improve women's health in accordance with commitments made at major international summits. Maternal mortality has been reduced, which has accelerated since the launch of the United Nations Secretary General's Global Strategy for Women's and Children's Health in 2010. In some countries, the use of maternal health care and family planning has increased. Progress has also been made in two determinants of women's health: girls' school enrolment rates and women's political participation, but not in others, such as gender-based violence and access to healthcare services. Poor sexual and reproductive health outcomes account for 1 in 3 of total global disease burden for women aged 15 to 44 years. Unsafe sex and violence are major causes of death and disability among women and girls in low and middle income countries, and they continue to disproportionately affect marginalised groups in high income countries. Women account for a greater proportion of older adults globally. Traditionally, women have provided the majority of healthcare, caring for both children and the elderly, often in the expense of their own participation in paid labour force. In later life, the consequences include high risk of poverty, less access to high quality healthcare and social care services, and poor health. Several serious medical conditions of old age, including dementia, are more common in women, but women have a more difficult time getting the treatment they require. Laws and policies have a direct impact on the realisation of women's and girls' health and human rights, including sexual and reproductive health and rights. National and subnational legal and policy frameworks should be aligned with the internationally recognised human rights norms and standards, and countries should establish or strengthen mechanisms for implementing these strategies. Another important focus is closing the remaining gaps should be on the persistent inequalities and inequities in the accessibility and quality of healthcare systems across and within countries. In many settings, healthcare systems continue to have limited accessibility for certain populations such as the poor, the elderly, adolescents, rural residents and residents of urban slums, as well as uninsured and undocumented, as well as limited capacity as measured by the indicators such as healthcare worker density, critical service coverage and use of health information systems and availability. Quality of care must go hand in hand with increased service coverage, and this alone does not guarantee health outcomes. In many countries, strengthening health networks, transportation, and referral systems remains an unfinished business. To increase coverage and facility access, first and second level facilities must be upgraded with appropriate infrastructure and equipment. An adequate number of skilled and motivated health workers must be provided, along with ongoing training and mentoring for women's health, including sexual and reproductive health care, as well as addressing violence against women. Despite process, persistent and emerging issues pose a threat to women's health. Responding to these calls for a comprehensive strategy that includes the implementation of effective interventions at both the clinical and health system levels. Furthermore, environmental, social, economic, and political factors that contribute to unequal access to care should be addressed in order to eliminate preventable deaths, mortalities, and disabilities among women and improve their health. A focus on inequalities and marginalised groups, including the humanitarian settings, will aid the convergence of high and low income countries with a generation. Thank you.